Sukhasana, or a seated position. We're going to do a little breath practice as usual, but I'm sitting on my block just to make myself a little bit more comfortable. So this morning's class is called joint movement, which we're about to do because that's what yoga is basically in a class. We all move together, we all breathe together. We might be slightly off exact synchronicity, but yeah, it's joint movement yoga, but we're thinking more about moving here through our joints. So come to your breath first of all, and just find it, see what's happening there. As you do that, at the same time, work on your joints and find your posture. So find your sit bones I call them, but actually it's your hip joints that would move and lift you up a little bit. And then it'll move into your pelvis and into your sacrum, which is the bottom of your spine. So then you're moving up through your spine, finding all the joints in your spine, seeing if you can lift out of them a little bit. And at that point, your tummy will have tucked, you might find. And just remember, your spine goes up through your neck, so your cervical spine is what's holding your head. So engage into the cervical spine and lift up through to your crown. And then in your inhale, take a big breath in and lift a little bit more. And in your exhale, just settle about 10%. Just allow your joints to just settle back into where they are. Now you've found stability through your joints. Just start then to lengthen your breath. It'll take you 2 or 3 breaths just to get engaged with it and start to lengthen and slow it down a little bit. Inhaling and exhaling through your nose. If it's available, if you've got a cold like some of us or hay fever, then just breathe through your mouth if you need to. Okay, so then move your hands to your upper chest and just place your middle fingers together and let your elbows drop down by your side. So let your shoulder joints just settle. And then find your breath again if you're not still with it. Breathing in. And here thinking of not the muscles. We can feel the muscles moving. We're very attached to muscles when we do yoga or exercise. But actually see if you can feel joints moving. So you might can feel your sternum moving. And your ribs moving with your sternum. Joints are where 2 bones meet, basically. Experts disagree slightly on that. Most of them will say it's where 2 bones meet. Others will say it's where 2 bones meet and move. You can feel those, probably not really aware, it's more the muscles on the top layers that you can feel, but maybe you can think of those joints just opening and closing a little bit as you breathe. Pop your hands then down to your ribs, same thing. Again, the joints are mainly now at the back of your body. It's on your spine here. Your ribs are joined to your spine. So as you breathe in, your ribs move. And those little joints that join them onto your spine are what's allowing your breath to happen, basically. It's giving you space for your lungs. And then pop your hands down to your knees just. We're going to continue with moving here in a breath practice. So once you're ready, we're going to inhale and we're going to take a 3-part breath, which is not the 3-part in the body. It's the 1, 2, 3 on the inhale and exhale down. Okay. So taking 3 movements on the inhale. Inhale, inhale, inhale. Exhale, turn the palms and bring the arms back down. So the breath continues through the 3 movements as you lift the arms up. Just slight stalls on the joint movement through your shoulder. So be aware of your shoulders now moving. Still moving on the breath. But probably not having to think too much about the breath now. We've got in the rhythm. But your joints, your muscles are lifting, but your joints are what's moving you. So here what's moving our shoulders are trying to synchronize. You might find one arm's lifting slightly quicker than the other. If you touch your fingers at the top, one will have reached there quicker, maybe minutely. Your shoulders are having to take the weight through the joint, the force through the joint of moving your arms up and down. But at the same time, one joint doesn't move on its own. Everything else is having to move. So you might find your hands, your wrists, little movements in them, your elbows, the joints there. You can feel them moving to try and take that force. Also your spine, obviously, where your shoulder girdle meets your spine. Your ribs, tiny movements. We're trying to keep our ribs down here. But the tiny movements in your rib joints where they're meeting your spine are having to happen. And it goes right down through to your hip joints, which are taking the sacrum through to the pelvis, through to the hip joints, taking the weight down through to the ground, because whatever force you've got has got to go through all the joints and come out somewhere, a bit like a lightning strike. So all the force is coming down from all those joints as you move, coming right down through your sit bones, really, as I would call them, but your joints there, and into the floor. Okay, take the arms back down. Come off anything you're sitting on now. So it's like a continual process through your joints here. So we're just going to warm up our joints and our legs here. So pop your hands behind you, one leg out, one leg lifted, and then just circle your, point and flex your foot. So point and flexing your foot. Watch your leg that's moving and see what's happening there. At the same time, think about your posture. So your joints are what make your posture happen. You might feel again it's your muscles. Your muscles move your joints into place, but your joints have to be in place to hold that position. So here, if you look at your foot moving, you might can see joints in your toes moving, the little bones through your feet. You've got 33 joints in one foot, which is a lot of little things moving there. And then right up through your, you see your calf muscles moving, but actually your ankle joints moving. Your knees probably not, you've probably locked it a little bit, but there's still some force going through there up through to your leg. Pop that foot down just for a bit of a rest and take the other one up and do the same thing, point and flex. So, yeah, as I say, there's a dispute here over how many bones we have in our body because different experts can't decide whether you should move through a joint or not. And there are several joints in our body that don't move, or quite a lot of them actually. So, but roughly on average, we've got 360 joints in us. That's a lot of moving parts. Just to do a tiny movement. We think of muscles, as I say, but if you think of the muscles, and actually the ligaments are what move the joints. So pop that foot down, lift the other one up now, bend the knee in. So bending that joint now at the knee, very complicated joint, and rotate your foot one way and then the other. Ooh, lots of clicking going on. So the clicking is in the joint, if you've got any clicking going on. And it's, as long as it doesn't happen all the time, it's just gas being released from the joint that's built up there. So it's something that probably needs to come out to stabilise the joint a little bit more again. And then pop that foot down, see if the other one cracks if yours did. Same thing, rotation of the ankles. So the muscles are holding us, but it's the joint that's allowing the movements here. Everything has to work together in the body, obviously. And then pop your foot down to the floor. Bring your right leg in then, and you can either keep your foot on the floor here if you're more comfortable, or you can lift it off into Sukhasana and wrap your arms round it, whichever you've done. Wrap your hands round the front of your shin and just draw the knee in. So if you've got your foot off the floor, flex the ankle and point it again just a little bit, just to feel that movement. You'll be feeling it going up through the bones and muscles in your shin, maybe through your hands. But it's the joints that's moving the bones. And here, think of what joints we're using. Okay, so if you just squeeze the leg in a little bit more, see if you can sit up a little bit taller, see if you can drop your shoulders a little bit more, see if you can draw your tummy back towards your spine. So that last movement was muscular. but it still involved joints. But most of the other points that I made there, it was your joints you were having to put into position to move you into position. Okay, let that leg out, give it a little shake through, and then take the other one in, same thing, foot on the floor or foot up, moving the foot a little bit if you want to. Think of lifting up and trying not to round through the spine too much. So think of moving your tummy inwards but forwards, if that makes sense. So back towards your spine, but then draw your tummy forward and lift up. And think about the cervical spine here. So think about the joints moving through your cervical spine. So the spine, the discs are actually counted as a joint because they technically connect the bones. There are facet joints in each vertebrae. You've got 4 in there. You've got obviously the joints we've spoken about in your ribs. So as you move your neck, obviously no ribs there, but you've got bones moving that are joining onto your skull, or joints moving, sorry, I might use the wrong technology here. And then drop the foot down, sorry, have a little rest, have a little shake out. Come now down onto your back, and we're going to take position for bridge. So come onto your back and get ready to do bridge. So not all joints can move in the same way. So coming into bridge here, we're flexing our foot, but not every joint can move in that same direction. Some can do many directions. Okay, so when you're ready, find your pelvic tilt first of all. So here we're just rocking gently, hips still on the floor, just pulling the tummy in, pulling the pubic bone up towards your belly button as you rock backwards and forwards, just to feel that little rock through the lower half of you here, the lower half of your body. So the rocking movements coming up through your feet, through the joints there, through your knees, back down into your hip joints, through your pelvis into your sacroiliac joint, through your sacroiliac joint into your spine. So it's moving your tailbone, but the tailbone's not the only bit moving. If you move from your tailbone and think of what's moving up your spine now here, just to facilitate this, I couldn't tell you how many joints you're moving, but you're moving an awful lot. Okay, so when you're ready, we're going to take bridge. Heels nice and close into the bottom, feet hip distance roughly apart. Hands can be used as support here, or you can turn your palms up so that you're just doing it through your feet. Going to breathe in as we take that pelvic tilt, and then lift yourself up through your feet on the in-breath, rolling up just a little bit, doesn't need to go too far, and then slowly taking it back down on the exhale. So it's inhale up with a little pelvic tilt, exhale down. And just continue to do it on your breath, nice and slowly. And as you do, see how many of your joints you can feel as you place your vertebrae back down onto the floor. That's why we say one vertebrae at a time. We're trying to move it really slowly there. You probably, if you're like me, I've got a few fused feeling vertebrae, so that I kind of dump back into the floor. So I have to take it really slowly at the middle of my spine there. So we're not all made the same. And you don't need, a balanced joint isn't necessarily symmetrical. It may be, for instance, if you're doing a side bend, that it needs to be unsymmetrical, but it still has to be balanced, and the force going through it has to go through in a balanced manner. Okay, so once you've done the next one, if you want to, you can take your arms into it now if you haven't already. So here we're probably moving just about every joint in our body. And I'm moving my jaw, so that's an extra one that I'm moving. So you maybe lift your toes off the floor while you do the next one. See if you can move your toes at the same time. Every joint has got lots of nerves in it. Everything is connected to your central nervous system. So all those messages, if I say move your index finger, you can do that while you're still doing this. So the body doesn't just take a message to one joint. And when it takes a message to one joint, all the other joints switch on and move with it. So they send messages to each other. I presume that's the way it goes. Or it might have to go back to your brain, but that's pretty quick. Okay, so come back down to the floor. Take your legs away from you. Have a stretch if you feel you need to now, or a rock through your hips, anything that you feel is needing loosened up. And again, it's not the muscles we're loosening here. Well, it is as well, but we're thinking joints today, loosening up. Okay, so then coming on to your belly, we'll take a couple of cobras here, in your own time, at your own height, whatever you want. But before we do, head on the floor, hands, elbows are close to the side, hands are, remember, just fingertips roughly at the top of your shoulder, your clavicles, your collarbones roughly, that sort of area. Feet can be hip distance or wider, remember. But here what we're thinking of is the joints in the tailbone again with the pelvis and gently moving that pelvic tilt forward again. So what you did in your back a minute ago, do it opposite. Well, it's the same thing, but you're upside down now. So you're moving the front of your pelvic and pubic area into the floor for stability here. You can switch on your glutes a little bit here. You can press into your feet a little bit if you want. The lower half of you, as we know here, is the stability. So when you're ready, using your inhale, use the other joints in your back to lift yourself up. So here we're thinking of all the joints moving one after the other from the bottom of your spine upwards. The muscles are lifting you, yes, but the ligaments are moving all the joints. Muscles don't move the joints. So lifting up through your spine, using the little joints in your hands and your fingers to just press into gently to get a little bit more lift. Tucking those elbow joints into your side for a bit more stability. Letting it ripple through, let the force ripple through the upper body here to allow it to move down through your pelvis and out into the floor. So force has to go through a joint and out again, otherwise that's when the joint gets damaged. But if you think of when you're walking, the force goes down through all your joints, just continue or stop whenever you're ready. The force goes down through all your joints and out into the ground. So that the force is coming through you and out. Or if you, for instance, throw a ball, the force comes through all your joints and out your hands and out of the bottom of your joints there to disperse. Okay, so come down to the floor again. Pop your hands under your head. Take a little rock through your lower half from side to side across your hips and your pelvic area. Just to loosen off those joints because they can lock. Your sacroiliac joint, your SI joint, you would know it as. You've got two of those either side of the bottom of your spine, your tailbone, effectively, your sacrum, that are joined onto your pelvis, the pelvic bowl. Those little tiny joints hardly move at all, but they do have to move. They're very unique in the way that they're made up and what they use to hold and to allow your bones to slide there. But they do lock with age. So that's often where people get a lot of problems in their lower back. So the fact that we move them very slightly and very gently and very carefully will keep them healthy. Okay, so then from here we're going to come up through down dog. Now anybody that doesn't want to do down dog, please take tabletop because we'll be coming back down to tabletop from it. So don't go up to down dog and then come back down. If you don't want to, you can go straight into tabletop. If you're in down dog, we're just thinking of moving through the feet. So moving the little joints in the feet, that 33, so 66 joints are moving through your feet. You've only got three though in each ankle, two in each ankle. You've got three bones there moving and meeting with two joints moving them effectively. So what joints are having to stabilise you here? Have a think yourself and see what you can feel, what you need to move into for the force. Be aware of what's happening through your body. Joints moving, joints stabilising. But even the ones that are stabilising you here, you'll feel that your hands aren't doing much, maybe your elbows, maybe your shoulders, but they are moving in tiny amounts just to keep that balance and force moving through them. Okay, so then gently come down onto your knees and onto tabletop. Have a little shake through again your hips if you need to. I feel very stiff this morning, so I'm going to do that. And then we're just doing cat-cow here, so really easy peasy. If you've been doing cat-cow for ages, then take it into dynamic cat-cow or do something slightly different if you'd like to. And just rock through your joints maybe. If you're doing cat-cow, remember it's inhale for cat, exhale for cat, inhale for cow. But if you're doing it differently, do not worry. Okay, so all we want to think of here as we do inhale, exhale, and move through two asanas here and in through neutral. It's the spine that's moving mainly, we're thinking of here in this movement. So stability in the hands, in the knees, in the feet. But everything from the spine outwards, your ribs are having to move through their joints, your spine is having to move through all of its joints. You've got about 100 joints moving just in your spine here, through your ribs as well. So they are joints that are attached to your spine, obviously, through your sacrum, your SI joint. This is a nice one if anybody gets problems down in the lower back. To just take it easy. And again, we're doing that pelvic tilt, remember. So you start on the pelvic tilt when you're doing cat. So your pelvic tilt and lifting your tummy up and lifting your heart up and moving through and dropping your head. So rippling through all of the 100 joints in the spine, but also your shoulders are having to gently move through the joints to facilitate this. Your hips are having to move through the big joint there to facilitate this. Okay, so coming to a standstill again. I'm going to need your brick in a minute, so, well, you're not necessarily, but you might want it. So we're going to go into gate. So in tabletop, we're swinging our left leg off to the side. So you just swing it round so it points at 90 degrees to where it was. And then you're rolling over and opening up into gate. So your right leg's sticking out. I like to point my foot forward there just so that I can feel that I've got that long edge of my foot holding me. If you're finding this a bit difficult, bring your brick in and you can use it at first or second height to bring me up a little bit more if you're finding that it's too strenuous dipping down. And what tends to happen if you dip down is you roll forward, and we don't want that. We want to open the body. So if you're finding that hard to stay up and open, then use a brick under your hand, because we're going to practice opening here anyway. We're going to take Robin Hood, we're going to roll forward, allow that spinal movement to come through all the joints, and then we're going to roll open by lifting our elbow and lifting the hand up. And then take the arm down again, fold at the elbow and then roll forward. Take it easy, there's a lot of force going through several joints here. See where you can feel that pressure going through. See if you can make it more easeful by taking it out of that joint and moving it along the body to the next couple of joints to take some pressure off it. So it might be by pressing into your foot or your knee that you actually help facilitate through your pelvic area. It might be through pressing through your hand that you facilitate lifting and taking the weight a little bit off that top shoulder by pressing into your lower hand. And then come back down to the floor. Just bring that other leg in, coming to both knees on the floor then, and change over to the other side. So all we're doing here is hand on there and stretching the leg out, or hand on the floor if you're comfortable. I'm taking it easy this morning, I'm going to use a block. So remember here, trying to get the alignment in is important. So we're taking the wrist, look down, check your wrist, your elbow and your shoulder are all in line. So it should all be under that shoulder. If your joints are out, then you'll put too much pressure through them, and we'll talk about that in a bit, but there's a lot of wear and tear goes on there. If you're feeling it anywhere in your lower half, it's probably through your lower back and spine, sacral iliac joint there that you feel it a little bit. That's because your body might have rolled forward. We're thinking of opening, so roll the joints in the hips and pelvis back round. Then you'll find the top half of your spine might need to be rolled open again. So if you need to, take a couple of those Robin Hood lifts just to get the body to start opening and knowing where it's got to go to. So that makes you realise how curved your spine has been in that position. You can put the hand up if you're comfortable. You can put it behind you here. I'm going to do triangle in a bit. So that's one way to do triangle, is to allow the hand to come behind you. So you would just lift it and then fold it so that you know it's keeping your shoulder joint open here. Take a few breaths here. Think about where you're needing to put some more force through, maybe through a joint to help the force that's going through others. Think about tucking your tummy, that's muscles we're using there, but moving then through the ligaments in the joints in your lower back to draw your bottom forward a little bit, because it tends to stick out in my case. And hands up, sorry, I haven't got my hand up here. If you want to, you can then just lower the hand over your head a little bit more. Take a nice big stretch down that side, and then you'll feel the force moving through. So we think of the stretch in the muscles here often in this position, but actually it's the force going through the joint we're thinking of today. So you can feel the weight. If we hang out here for too long, you'll certainly start to feel the weight going through. If you press through your knee and your hand a little bit more, and maybe that back foot, and see if you can just lift and open and take some of the weight out that upper shoulder joint. And then gently we're coming back up, taking that knee in. We're coming up now, Sarah, so if you want to come up, do it in your own way. The rest of us, let's go back round and come into down dog again. So pressing into the hands, lifting up through the pelvis as if I'd hooked you under your pelvis there, lifting up through to down dog. Feet might still not be on the floor, it might not be quite open enough at those joints yet, and the muscles might be a bit tight. You can have a little walk the dog if you want, and then walk your feet forward, come into forward fold. So the spine has then moved and opened the joints so that the back of the body can open, but the front will have closed up a little bit. Okay, so then gently either sweep up or roll up, whichever you'd rather. So different movements. If you've swept up, we're going to roll back down again. So hands down to the side and just roll down now. Why do we always want to sweep and do the flourish rather than the roll? The roll is actually using more joints, and well, maybe not more, I haven't counted, but it's certainly once you're down there, we're going to roll back up and down a couple of times. Just take a few roll ups and downs. So you're rolling up on the inhale if you can and opening up, taking it nice and slow on the breath and rolling down on the exhale. Take it easy. See if you can lift your toes or maybe wiggle them around. See how you can relax your arms a little bit. Shake through those joints. Release through the arms. Your spine and your legs and leg joints are doing a lot of the movement here for you. Couldn't do it without your muscles, but they are superficial to the movement actually in your joints. They're not superficial to your movement, but superficial to the joint movement. So as you go down, see if you're symmetrical. See if you can find any differences in where your hands are on your legs. Or it may be you've put yourself into that. It may be that you've been born like that. We're all born slightly not symmetrical. But it might just be that you're actually putting your weight through one side of you. Your joints are taking it through one side. If one leg feels slightly heavier than the other, sorry Sarah, we should have said that for you if we're coming up to the top now and we're stopping. So anybody with any head issues, sorry about that. Hopefully everybody wasn't near enough to stay still or do something else. You can always take something else when it doesn't feel right for you in yoga, remember. Okay, we'll take a little joint flow now. So grab your 2 bricks and pop them at the front of your mat. We'll have to move them again in a minute, and that's fine. Stand not a whole body's length, probably away from them. We'll draw them into where we need them in a minute. Okay, so thinking of our joints, just rock through your ankles a little bit here, through your feet. Open up all the little joints in the feet. Some crack, some don't move quite as much as the rest of them. Your toes have got 3 joints each, your big toes only got 2. Okay, so once we're ready, we're going to inhale, take the arms up above our head. As you exhale, step your right foot back and come into high lunge. Bring your hands round and come into prayer pose. Okay, so we're in high lunge here. As you inhale on your next inhale, take the hands up, hands together in prayer, and lift them up above your head. Exhale, bring them down. As you come back up the next time doing the same thing, think of what's happening in the joints in your back foot. Think of what's happening in the joints in your hands. So they don't seem to have much to do with this, your hands, but actually see if you can get them more involved. Press your joints of your hands together and feel the force then move up through your elbows and into your shoulders. One more in this. Take the hands down to prayer. Bring the back foot in just slightly and flatten it onto the floor. So you're putting your heel down, in other words, and then you're straightening that front leg, and we're going into pyramid. So we're going to fold forward, and you want to bring your bricks in as you do that to meet you. We're folding on the hip flexors, I always say, but it's actually your hip joints. So see if you can just, before we move, if you've gone already, come back up. Just gently take your hands on your hips and move your back hip forward slightly, your hip joint. Feel it roll through that hip joint so that your pelvis feels square to the wall in front of you. And then keep your hands there as you fold gently forward, keeping a long spine here. So we're thinking of opening up through the joints in the spine as you move forward. If it gets too strong for you before you can reach your bricks, just soften that front knee. You have to do that maybe to bring your bricks in anyway. Bring your bricks into either side of your feet on tall, hands on them, and then just gently press into the bricks and open that front leg a little bit more if you can. Just watch your hamstring, it won't be really hot. As you lift your toes as you do that, exhale and draw your knee forward, bend your knee joint rather, and then press gently in again, lift up your toes as you do that, move into the joint of your big toe and your heel. So you're just opening and closing the front leg here. So as you're doing that now, think about your spine and think of all the 100 joints in it. Try and open them up by reaching the crown forward. Think about your hip joints. Are you moving symmetrically? So see if you can take your hips and make them a little bit more parallel to the floor. See if you can roll up onto your heel the next time that you open that leg up. And then gently pop your foot back to the floor and see if you now can come in to pyramid in a better fashion. So you're in pyramid rather. See if you can lift your crown, tuck your chin, open the back of your cervical spine, opening the joints there. Lift through the crown, but see, square your hips up slightly to the floor a little bit more. Should feel that then going up through the back of the front leg. Press gently into the heel of the back leg, press gently into that foot. Move your hips back by doing that. You should still, again, feel it through your hamstring on the front leg, but you might feel the weight coming off the joints on the front foot. Okay, so then bring that foot forward, the back foot forward, sorry. Stand up slowly, come back up to the top. Turn to the front, move your bricks, we'll go to the other end in a minute. So we'll turn to the front, we'll do it as a flow in a minute, a bit more, but turn to the front, open the legs a bit wider than hip distance, feet facing forward. And come into 5-star and lift out. So force here, where's it going? The force through all your joints, into your feet. You can probably feel it. If you can feel it in your heels, move into your front of your foot. Disperse the weight through more than one joint, in other words. Lift through the back of your shoulder blades. So draw your shoulder blades slightly together so your arms come out a bit. And you might feel your weight comes off your arms a bit more there. So moving the weight from the heaviness of the joints in the arms down through the shoulders, through the joints into the spine, which will then take all that force through all those little joints in your spine, down through your SI joints, into your pelvis, into your hip joints, down through the legs, through your knee joint, into your ankle, and out through your feet. Let the arms come down. That was quite tiring. Okay, turn the feet out, come into goddess. So slowly bending the knees, make sure the knees are over the ankles, not outwards. Try and keep that alignment through the joints so that the force can move through comfortably. Hands can stay here in heart center, or you can pop them into cactus arms. Think about moving that tailbone under a little bit again. If you feel that then in any part of your back, draw your shoulders back and try and align your joints in your spine. Inhale and open up into 5-star. Exhale, come down into goddess with arms wherever you're comfortable. Inhale into 5-star. Exhale, back down. You take 2 more. Oh, that was a nice big crunch in my knee that time. Open up again. So virtually every joint is moving here. But maybe not your spinal joints. Well, maybe they have to. Everything has to facilitate. If you're just moving your arms and legs and not moving anything in the middle, then how's the force moving through you? It has to all move through every joint in your body, really, in these movements. Hands come down, turn to the front, come into your pyramid on the front here. Same thing, just bending and opening that leg. So do the leg first, then think of the spine, moving through the joints in the spine, opening them up, lifting the tummy, squaring the pelvis off. See if you can facilitate the movement by putting your joints into the right position, basically. It's not just making it happen, it's actually making it easier through your joints. So the force isn't so great going through them. You're not compressing them so much. And therefore, it's actually more healthy for your joints to know how to move through them. Okay, so then step the foot forward and come back up again. Right, let's just take that as a little flow. You might have to lift your bricks with you, that's the only thing. So when you're ready, arms up above the head. Let's get those joints moving a bit faster. Hands come down on the exhale. Step the left foot back this time, come into high lunge. Hands come to prayer. When you're ready, inhale, take the arms up above the head. Exhale them down. Take 2 more of those. Inhale up. Exhale down. Adjust the back foot. Adjust the front leg. Adjust the pelvis. Move forward through the joints till you can reach your bricks. Come into pyramid. Take 2 breaths here. So flows do stop sometimes just to stay in that position and breathe. And then lifting your bricks, soften that front knee, push through the front leg. You can rearrange yourself to face the right way. I'll have to turn so that I come into 5-star and lift the bricks up. A little bit extra force going through. Turn the feet out, come into goddess. Reach out, come into 5-star. Goddess 1 more time. 5-star technically, you can have your feet wherever it's comfortable. In goddess, we turn the feet out because that works better for the force through your joints. If we were folding forward, we would turn our feet forward. Okay, so then turn the right foot so you're facing towards the right side now. Turn the back foot, prepare, and we're going to fold forward into Parsvottanasana. So pyramid. Reach out through the crown, take a couple of breaths there. Think of moving joints and how you can make this feel more easeful through your joints. So maybe adjusting your pelvis, have a little wriggle. Maybe lifting your toes and moving more into your foot. Maybe it's your hands and your crown that you need to move. Leave your bricks where they are. Put your hands to heart center, to Anjali Mudra. Soften that front knee, push up gently. Adjust the back foot, come into your high lunge. Inhale, take the arms up above the head. Put in a little back bend if you can this time. Exhale, bring hands down. Take a couple more there. So the back bend is moving your spine into a different position. Your joints are having to take another movement then to open up the front of your chest. So we take axial extension first of all when we're doing any movement through the spine we talk about. Step forward, come back into Tadasana. So that's the axial extensions to allow your spine to open up so we're not compressing it through these movements. That's why I talk about fluffing the pillows, etc. Okay. So I said we'd take triangles, so keep a hold of one of your bricks. We're going to try triangle here. We've got a lot of joint differences here and a lot of movement. So coming into this in an easy way. Step the foot forward, the front foot faces forward. The back foot, make it feel comfortable. So it'll go to wherever feels comfortable. But then just check that your joints, your hips are in the right place. So have a little sugar about it. I can't tell you where's the right place exactly for you because your joints might be different from mine. So although I give you cues, you must find your own way. Okay, so this front foot should feel that the inside leg is open. Okay, so you can soften that front knee and reach down and reach for your brick. This is an easy way to come in. As you do that, same as in gate, you've rolled forward probably. So then we're going to do that thing we did in gate with Robin Hood. So elbow back, push the front leg, open up and take the arm up. Roll forward, soften the front knee again. So same thing as we did in Parsvottanasana with that front leg, we're folding and opening. Same thing as we did in gate, we're folding and rolling open. And then this one, whenever you're ready, stop and stay. Now the brick here for me is far too far forward for my shoulder to be in mine. So I'm bringing the brick now inside my front foot. And then I'm thinking of that top arm. It can be down here, remember. What we're trying to do is open that top shoulder. So you can reach, that's fine. But don't throw your arm backwards. Keep the arm in line with the other one. Keep the joints running straight through your shoulders down to your wrist. If you've got the hand behind the back, you're just thinking of gently opening, but don't push your tummy too far forward. Okay. And then soften that front knee, push off, bring the brick up, adjust your feet and come to the other side. So we know that the brick, initially I had it out here a little bit. That might work for what you're doing here, but it might be better to put it inside your foot to start with. See how you feel. My feet were too close there. I need to have them further back. My body's telling me that. Adjust your joints. Okay, so then taking the hand and opening up. You don't need to take the arm right up if it's too strenuous here. Softening that front knee each time to start with, just opening up through the joints. If we just hold the joints in one place, yes, they're stable, but if you've put them into the wrong position, then there's too much force going through and you could damage them. So it's good to work into a position by opening and closing. And then you'll settle where your body's comfortable. And as I say, it might not be where mine would be comfortable. So arm up or behind you here, and think about gently pushing into the joints in the hand. Let it ripple through up to the shoulder, and then open up that top shoulder. Rolling through the spine a little bit there. Draw your pelvic tilt forward a little bit, just a little bit. If you go too far here, then you'll feel it through your SI joints. So just be gentle there. They only move 2 to 3 millimeters at the most. And even then, that's not great. Okay, how are you feeling? How are your joints feeling? Okay, so letting that front knee soften, coming forward, letting that knee push you gently back up to standing. Bring the feet together. We're going to roll down, come back down to the mat just for a quick cool down. So rolling down or coming down, however suitable for you this morning, down to the floor. Take it easy, let your joints move slowly. For some of us, they're quite old joints. Come down onto your back. Have a little roll through if you need to soften your joints into the mat. Then bring your right leg in and your left leg in. So you've got your hands on your knees, fingers facing towards your feet. And then just do some hip rolls. So we're stirring the pot, we call this one. It's the one where we're rolling the leg, the thigh bone, through your hip joint. So the ball and socket we're thinking of here in that joint. We're just gently rolling through them. It's a synovial joint. Most of the joints in your body are synovial joints. They're the ones with the best mobility. And as you stir this, the synovial fluid is what's helping lubricate. You've got hyaline cartilage in there at the top of the bones, which takes a lot of the pressure through, the force through into the bone, kind of like a shock absorber. And the synovial fluid is what's lubricating here to roll through the joints. So as you do this, do it a little bit bigger. Maybe you can start to feel it rolling through your shoulders as well. Shoulder joints are much less deep and therefore easier to pop actually. But same sort of joint, same synovial joint. So there's a lot of mobility through your hip and shoulder joints. Okay, pop the feet to the floor, take them to the width of the mat, your feet, and just do some windscreen wipers. Start slowly, and when you're ready, start to move your head if you're comfortable doing that. Don't need to do this bit, but if you're comfortable, pop your head in the other direction from the way your knees are going. Take it slowly though, don't move too quickly. So particularly your neck, you must take it easy through those joints. A lot of weight. Your weight's on the floor here, obviously, so it's not quite so strenuous for your neck, but just rolling gently through the back of your skull. So your skull was once a lot of joints called sutures, but they eventually, when you're little, they all join up. They're obviously mobile to allow the birth process to happen, but once you're born, they start to close up, and that's why you have these sort of lines when you see a skull, that sort of lines where they were once moving parts and they're now not. Body's such a clever thing, isn't it? Okay, come to a standstill. Stretch your left leg away from you, bring your right leg in, pop your left hand onto your right knee or onto your thigh, and just gently roll that leg across you. So don't need to go too far, don't need to go into a full twist. If you want to, that's fine. But otherwise, just rolling through to open up that hip joint a little bit more in a different way. And you might find that moves straight into your SI joint, so just be careful. Take a couple of breaths here. So arthritis, 350 million people worldwide. Moving into the other side when you're ready, 350 million people worldwide have arthritis. That's a huge number, and think of the health cost for that. And arthritis, yes, there are different types. I think there's about 100 different types. Just take a breath where you are, and then move back into Sukhasana when you're ready, just to finish. There are about 100 different kinds of arthritis. The common one is osteoarthritis, and that's where the cartilage that I talked about that supports your bone at the top of it it wears down and the bones begin to rub, and then the bones go misshapen and it causes a lot of pain as they then continue to rub together. Rheumatoid arthritis you'll have heard of. It's an autoimmune disease. The immune system attacks and causes inflammation. So that's a little bit difficult. It's not as much your fault in the way you move. And gout, which might be our fault, is also a form of inflammatory arthritis. But a 7-year clinical trial found that yoga effectively managed both osteoarthritis and rheumatoid arthritis. 8 weeks of a yoga class showed a 25% reduction in pain for the participants with those conditions. So yoga is fantastic for our joints. We know that. We know by compressing the joints, etc., we're keeping them healthy. By keeping them moving, we're keeping them healthy. By moving with thought and mindfulness, we're keeping the joint structure and the cartilage healthy. And that's what we want to do, is keep ourselves healthy. So when you're ready, come up slowly to finish our class in Sukhasana. I'm going to give you a couple of fun facts just to go with here. Fun fact 1 is, if you hit your funny bone, it's not a bone you've hit. It's actually a nerve on the top of your elbow joint. Fun fact 2 is that the connections between your tooth and your jawbone is also actually a fibrous joint, which contains collagen, which is that thing that we lose and don't get back as we get older and skin sags, hence why we probably lose our teeth. I'm not a dentist. That might only be one small reason, but it is partly probably. And fun fact 3 is, I often tell my husband, and he laughs at me, that it's going to rain. But our joints contain sensory nerves called baroreceptors, and these receptors read and react to atmospheric changes in the barometric pressure. So when a thunderstorm is approaching and the barometric pressure drops, some of us can tell through our joints that a storm is coming. So, as usual, I was right after all. So thank you everybody for your practice this morning and indulging us in some joint movement. See you next week. Namaste.